Okay, so we're going to be doing COVID vaccination, and we have some fancy. This was really made fancy for me, and we're going to go into the agenda. We're going to talk about a brief background on COVID and the needs assessment, an action plan, and event details, and then the contact information for anyone in the community if they're interested. We'll have the hours that they can get vaccinated. So here's a poster that gives our hours of vaccinations, our vaccination clinics, and at the Gateway building, which is 817 Federal. Vaccination is on Mondays and Wednesdays from 4 p.m. through 8 p.m. Clementon location of Camcare. It's on Tuesdays from 4 p.m. to 8 a.m. And our regular general number is 856-583-2400. And you can see that there is a gift card associated with individuals who receive the COVID-19 shot from an awesome place. And if anyone is a fan of Wawa and a Wawa sandwich, and anybody who leaves this area, like my son who is in the Dallas-Fort Worth area, is devastated because whenever he comes back and visits, the first thing he wants to do is go to Wawa and get a sandwich. So Wawa gift certificate is one of those great incentives to help get vaccinated. Go to it. So just as a brief introduction, on May 11th, 2023, so that's this month, tomorrow is June, so yep, this month, the Biden administration announced that the nation's public health emergency had ended. This is in conjunction with the World Health Organization, which 2 weeks ago stated that the world pandemic was now over. So I guess the question becomes, does that mean that we don't have to worry about this anymore? It's over, right? It's gone. It's not an issue. Monica, what do you think about that?
Well, clearly it is still an issue, but it's an issue that we now live together and figure out how to live with this ongoing viral illness. And I think because we have vaccines, because we understand how to isolate and quarantine, I think we can do that. I really do. But our job is really to get people vaccinated, because that is by far and away the best thing to prevent us from getting serious illness.
So the message that we are telling our community is, I hope that hearing that it's over doesn't make you think we're going back to 2018, where we don't have to worry about, because everyone would like to just pretend like this never happened. But you'll see how many deaths worldwide there was from this virus, and how even though the pandemic may be over, the virus is here to stay.
Exactly.
Amanda, do you have any thoughts about that? Amanda's muted. I wanted to see if she was listening. Nurse Amanda? Okay, I guess not. Anyway, okay. So the country's increase in COVID-19 vaccination has reduced the number of serious illnesses and COVID-related deaths. As Dr. Burton and I were talking in a prior discussion about COVID, we know that our country is the third most populated country in the world, and we have about 0.8 billion or 800 million people in that country, in our country. And we had a very, very high infection rate. So in many parts of our country, especially in those areas where we had good vaccination rates, we certainly protected people from serious illness and deaths. And we started really seeing the impact of those that were vaccinated after New York City was hit and the West Coast was hit, probably within 6 months to a year of having the availability of that vaccine. Though numbers and hospitalizations were high, we were seeing that most emergency rooms that were inundated with people who were very, very sick were from those areas where there was under vaccination at that time. After that fact, in 2022, the next factor was those who were infected and were doing okay. We started seeing something called herd immunity. And if there's any questions about that from the community, Dr. Burton and I would be very happy to answer those questions. Now, Camden and Gloucester County have had alarmingly low rates of vaccination. And this is where Camcare Health Corporation comes in, because we are here for you. We are here for the community. And we don't feel like we've done the best job possible if we don't encourage our community to come and get vaccinated, to have that additional tool in the toolbox to protect them from illness. So this is about why we're doing this right now, even with the pandemic officially over. And our goal is to provide access to vaccination, along with the education about why these tools are available, and to have those vaccinations, initial vaccination, and of course, the boostering of the vaccine to continue to protect the community. And we are, and will continue to offer numerous vaccination events to encourage participation. Camcare is, like what we're doing tonight, is going to be offering education sessions, and we're going to be informing our neighbors throughout the next couple years about things for COVID-19 vaccination prevention of disease. There is a really nice, positive coronavirus COVID-19 picture. Okay, so Monica, do you want to do this?
No, you can go ahead. You're doing great.
Okay, I don't want to take up, I don't want to be like the guy, you know, and that's his thing.
No, you're doing beautifully.
Okay, so COVID-19, originally coded as SARS, because it was a respiratory illness, CoV-2, appeared in Asia, to specifically in China, in September, October of 2019. And that's where it's got its COVID-19, because the disease initially struck in the East, in the area around the Asian area, and specifically China, in 2019. It crossed over, and we started having cases January or February of 2020. And the first place it hit was Washington State, interestingly enough, right across from the Pacific from China. So you can see how disease goes where people go. And that's where it started. It's believed to originated. No one really knows how it originated. One of the theories is that, and this is the most politically correct theory, is that it was an animal to human transmission. The interesting thing is, because the origination of the disease also was at a research facility, it's very possible that accidentally, while scientists were isolating coronavirus, that something happened and this very infectious virus escaped. And no one's ever going to know, and it really doesn't matter. Was it done out of malice? No, there was no great conspiracy. Either somehow there was a mutation from animal to human in a wet market, where there were live animals that were being sold to be slaughtered and eaten, or if it happened from the scientific institution, it doesn't matter. It wasn't done with malice, and that's what happens when there's billions of people on the earth and we have infectious diseases that spread. So again, it started in 2019. By 2020, it started to escalate around the world. And by March, it was March of 2020. It was my birthday, was right the day when we were declared that we had an emergency and we started shutdown. So it was very fast, less than 6 months time from China to all of the restrictions that we started living in 2020. And this is kind of crazy, because I remember when it reached 6 million, and that was like 3 or 4 months ago. We almost have 7 million people that have died worldwide from COVID infection. And that's a sad number. There are roughly 7 to 8 billion people on planet Earth. The most populated country is India now. It just surpassed China and the United States. There's 1.6 billion people in India. There is 1.5 billion people in China, and there's 0.8 billion people in the United States. And then all with everything else, you're dealing between a population of 7.5 billion people. And 6.9 million died worldwide since the start of this. Now, we know that one of the greatest impacts to fighting this pandemic was the vaccines that were created, the RNA vaccines that were created, which have dramatically slowed down the spread of COVID-19, allowing more mutations to occur, which led to a much more infectious but less lethal subvariants. And we can talk a little bit about why that happens naturally, how viruses that are very, very effective at killing people aren't very good at spreading because people are dead. And then once they're dead, they can't spread it any longer, versus vaccines that just make people sick. So they make lots of virus, but then they get better, so that these viruses tend to be the strains that tend to predominate, and you get a less lethal but more contagious virus. And that's exactly what happened with COVID-19. Any questions, comments from the audience? Anything they'd like?
Yeah, Dr. Kaplitz, we have a question from Mujiba and where her team is currently at. And you may get to this in a later slide, but how many vaccinations should our cards reflect, including the boosters that are currently out?
How many?
Yeah, I saw that in the chat from Mujiba. Basically, it does depend on when you got your vaccines, but everyone gets 2, and a bivalent, and now at this point, it's usually going to be 3 to 4, Mujiba, for most people, but it really does depend on when you're getting it. If you're just getting it for the first time now, or did you get it when, like I got it way back when. So, the age matters. Are you talking about a specific age, or?
I'm not sure about the age. Someone had written me directly and asked how many vaccinations should their cards reflect, including the booster.
Most people, when we first started getting the vaccine, we got 2, and then you got a booster later on. Now, it then mattered your age in a sense, because if you were older, you would get another one. There was a recommendation. But children 6 months and up still get 2 plus the booster. So it's going to vary between 3 to 5 is really what it is.
Yeah, the interesting thing about the vaccine is the antibody response that's effective pretty much at reducing the significance of the disease is transient. It doesn't stay in. Most of the studies indicate that you get about a window of 3 to 4 months of significant protection, and then it starts waning off pretty quickly. So I'm in my 60s. I have borderline diabetes, diabetic. I'm overweight, though I'm trying to lose the weight. I'm much more susceptible if I receive COVID at getting having a greater chance of becoming ill. Understanding that it was transient, when the pandemic was going on, I pretty much was getting boosted about every 6 months. After the 5th one, things started to really slow down. And now recommendations look like, again, the recommendation is going to be for an annual vaccine, and it might be in conjunction and matched with the influenza vaccine.
The other point, and Amanda put it in the chat, and she's right. So in September 2022, the bivalent vaccine that came out, that was what we all needed and should have gotten. So if someone hasn't gotten a vaccine since September 2022, they need another one.
Yeah. Again, these 2 subvariants are going around. And again, you only get a transient protection, significant protection, and then you get a fast waning off. And this is coronavirus. Actually, that family of viruses is one of the 4 families of viruses that's associated with upper respiratory infections or the common cold. And there's never been an ability to develop a vaccine for these conditions, because whatever response you get is very transient. The good news is that this is a little longer than some of the experimentation with some rhinovirus and some of those other common cold variants.
But so what you're simply saying then is that we will likely need to get vaccines the way we get the flu vaccine frequently. And many vaccines, as you know, like Tdap, we recommend you get every 10 years. You know, it is not unusual to need a booster for vaccines. So this doesn't mean it's a bad vaccine. It's a changing virus, and it's an amazing vaccine, actually. So I don't want people to think that it's a failure because we have to get more than one.
Yeah, it's just the way our immune system works. And Dr. Burton brought up Tdap, and Tdap, I'm an obstetrician. Tdap is a vaccine that we try to give every single one of our patients when they enter the third trimester, because whooping cough, again, is one of the pertussis, is one of those viruses that if a newborn catches pertussis, they are deathly ill. It's a really, really horrible thing to happen. Likelihood of it happening is low, but it happens. And by vaccinating pregnant women, they are passively giving their antibodies to their newborns to help to protect their newborns. And interestingly enough, Tdap is an every 10-year vaccine, but it doesn't matter. A pregnant woman could come in every year with that pregnancy and will be offered Tdap. So she could theoretically get Tdap, that's how safe it is, every 1 to 2 years when she's in third trimester to protect her newborn.
Mm-hmm.
So people can't overdose on vaccines. If the community ever thought, what happens if I got an extra vaccine? Your immune system can only respond to a certain level, and then the vaccine does nothing. It's not a toxic agent. It's simply a tool to turn on your own body's immune system. And the limitations of the vaccine are the limitations of the human immune system. All right, let's go on to more slides. Okay, so variants. So viruses mutate, and because they're pieces of genetic material, they're not really alive. They reproduce by being in live cells. They go through many mutations and they go through generations so quickly that you get variants. So all of the viruses change over time. And we're talking about changing over a very small amount of time because of the billions of people that are being infected. The more people infected, the faster you see these changes. Since the beginning of the pandemic, we've used the Greek system to designate the original COVID-19, which was pretty deadly, and the Delta variant, which was pretty deadly, predominated in producing our ICU sicknesses and deaths. But we had an alpha. I don't remember the beta one. I remember alpha. I remember delta. And then once we got into Omicron, the virus was settling in such a way that the mutations were much smaller from the molecular chain. So they decided to stop with the Greek alphabet and just give all these little sub numbers of Omicron. But they are mutation changes. They're just at a smaller molecular level. And that's what scientists do. So right now, Omicron is the predominant strain in the world, and there's some substrains of that. The newest of these substrains is, and this sounds like Star Wars, like, BB-8, I love this one, is XBB.1.5. And that's what's causing the most infections in the United States right now. The way this is determined is to take some positive cultures and then to do genetic studies to determine what variant they are. In the United States, we're very poor at doing this. Europe was very good at doing this, but we're getting better now. The labs are getting better of taking a sampling of specimen and subtyping it to see what subtype it is and if there's any new changes or mutations to that. So the latest one is Omicron subvariant XBB.1.5. Don't have to remember that because I'm not. How contagious is Omicron? Omicron is very hard to avoid. Omicron is very contagious. In terms of its contagion quotient, is really, really high on the list as being one of the most contagious viruses. The good news about these subvariants is they're getting better at infecting people, but also giving more mild symptoms. And with the combination of people being vaccinated and being exposed and having herd immunity, we're seeing we're not seeing a surge of people being admitted to the ICU. We don't see a surge of people getting placed on the ventilator. We don't see a surge of people that have to be placed in the prone position who are critically ill. We don't see a surge of people who have to go on a special lung machine called ECMO because their lungs are failing, like we did with the Alpha, and then most deadly, the Delta strain. Can vaccination prevent disease? Great question. People ask that all the time. I got the vaccine and I got sick. The answer is that getting vaccinated should protect you from severe illness and from hospitalization. If someone gets infected after they've been recently vaccinated within the last 3 to 4 months, theoretically, symptoms will hopefully be either very, very, very slight or mild, but not significant. Can we find a way to prevent exposure? You can wash your hands, you can wear your mask when you're in public or you're in a health facility. You can do all of the things, you can swab down your areas, and you will be doing measures that will decrease the likelihood of you getting sick. However, it is impossible to shield yourself completely from getting COVID. And poor Dr. Burton, who was doing such a great job for years, knows that no matter what you do, you just can't always protect yourself. And she might blame me because we're at a meeting and I wasn't wearing my mask. And I keep thinking that I didn't know it and I got her sick. We just don't know. We just don't know. But we can use all of the tools available to us to protect us. Once I get through the slides, Dr. Burton and I will be very, very happy to answer more questions. So booster vaccines are vaccines that are given after the initial 2 vaccines of the messenger RNA vaccine, which will further stimulate antibody production. And we're going to be talking about the bivalent vaccine further along, which is 2 strains to help to have that immune response to help protect us from significant disease and hopefully disease at all. While the original messenger RNA vaccines have efficacy, the newer strains of the vaccine are hopefully tailored to protect these new variants. The last study that I saw, disappointingly, did not show that. However, I read that paper about 9 months ago, and hopefully we're starting to see science now that tailoring the vaccines to the new subvariants is going to have better protection than the original vaccines. Okay, now there's a lot of stuff that was circulated because social media made COVID-19 a political thing. And there's nothing more that scientists and doctors hate than trying to dance around the political, social ramifications of something that should never have get into that stage, that area. And so some of the things that I'm going to go are some of the myths that people have heard, and hopefully if our community is listening, they can have us expound on any of those issues. One of the myths is you can delay vaccination until the pandemic is over. And that's counterintuitive to, again, the logic of the pandemic is now over. Why would you vaccinate when there's nobody getting sick, right? You want to use the tool to boost your immune system when people are getting sick, so that postponing vaccination it makes no sense. Every month you postpone the vaccine, if you haven't been exposed, increases your chances that eventually you're going to get COVID-19 and then have to fight it off and have your own immunity because you were infected.
And just one other thing, Dr. Kaplitz, it's the same as all the vaccines that we give the children. We're not giving kids a measles, mumps, and rubella vaccine because we don't see a lot of, let's say, rubella anymore. We continue to give all these vaccines, polio vaccines, tetanus, diphtheria, everything, hepatitis A, B, so that we don't run into a problem like masses of people getting these diseases. So in order to keep these infectious diseases, at least at a very low level, we have to just continually vaccinate everyone and keep up with the schedule and the boosters, et cetera.
Absolutely. And that's one of our challenges, is that during the pandemic, when people weren't coming to see doctors, people were at risk for missing diagnoses of early cancer if they weren't getting their mammograms. People were having difficulty getting their annual pap smears. And I think one of Camcare's mission was to never stop delivering those essential services of vaccinating our children and doing our routine screenings to keep people healthy, because neglecting yourself because of the pandemic, it made absolutely no sense. So that's why the doctors were frontline, and that's why we were getting vaccinated, and we were protecting ourselves so we could be there for the people that we take care of. And children getting all those other vaccines is critical. There are areas in the country where there are anti-vaxxer communities, and measles was something that you thought you wouldn't see small rises in a community, a small little epidemic of measles, and it was actually making children very, very sick, and there were even some deaths in Washington State, and it's kind of terrible. And these are things were totally preventable, absolutely, totally preventable. If those children would have gotten their vaccines, that simply would not have happened. And I can state that pretty much as fact. You're not going to get measles if you're vaccinated for measles, and we have the tools to keep ourselves healthy. COVID-19 vaccines were developed too fast to be safe. And that has to do with when you hear DNA and RNA and you start reading social media, you start thinking that people are fooling around with your genetic code and you get all of this craziness. Actually, messenger RNA technology goes back into around 2000, and it took 20 to 25 years to perfect and utilize that technology so that we could have our first messenger RNA vaccine. And now the messenger RNA vaccine door has been opened for all these other potential medicines that will be utilized with this amazing technology. But this was not fast. This was not experimentation. This was based on over 20 years of scientific research to develop this stable messenger RNA that could code for the protein so we could have an antibody response. Myth 3 was there weren't enough clinical trial participants to declare the vaccine safe. So that's an argument. It's certainly not true. The good news is I'm not dealing with 2020 or 2021. I'm dealing with 2023. And we're dealing with the middle of 2023, and we're dealing with 8 billion people on the planet and triple the number of people vaccinated. So clearly stated, even if you believe that, now with all of the vaccination that's happened throughout the world, we know how safe getting vaccinated is. So the time is our friend. In this case, if you wanted to have that argument in the beginning, you would have to wait for more and more people to get vaccinated for the data. We've had so many people vaccinated that there's no point in even making that claim because we know how safe it is. I already had COVID-19, so I don't need the vaccine. This is actually a really good myth. And it's the same thing is true for the vaccine. You get transient protection from being sick with COVID-19, you make your own, and it's not even as good an immune response as the immune response from being vaccinated, where it's more concentrated. So if you had COVID-19, it might protect you from getting sick for 8 to 12 weeks, but then you can get sick over again. And we've had patients who've had multiple COVID infection at least twice in a year. So even getting vaccinated, again, there's only transient, and that's why you need to get boosted. And what did I just do?
It's an interesting question about, I was just trying to think what's the most number of cases I've seen in one person of getting COVID? I've certainly seen people get three episodes of COVID infection. I've seen that. I do not know if I saw anybody have 4. It's just an interesting question, but it's like playing with fire,
Yeah.
one time, you just don't know what's going to happen. That's the big problem with this disease.
I think it's sad when I hear stories of someone who had COVID in 2020 and then got re-sick in 2021 and got really sick in 2021 and then passed away. I've talked to people who've had family members that happened to. I'm not saying that happened to a lot of people, but that unfortunately, anytime you get COVID, there's always that potential, especially with the earlier strains like the Delta strain, to get very, very ill and to end up in the intensive care unit. The next vaccine has to do with that RNA, and it changes your DNA in your nucleus. And this type of RNA, this messenger RNA, codes for proteins. So it gets into the muscle cells where you inject it, and all it can do is assemble proteins. That's what it does, and it's only transient. So not only does it not mess with your DNA, it acts as if it was made by, it's made by DNA in vivo, meaning, but we didn't make that, but all it can do is assemble proteins. And what it does is it assembled the spike protein of the virus, specifically so we would have an antibody response to that. It does not mess with our DNA or our genetic material. It is not genetic therapy. It's not genetic engineering. There are medical treatments that are being worked on with CRISPR to do that. Right now, we do not have there may be 1 or 2 pilots for specific diseases, but genetic engineering medication is very, very difficult to engineer. And we're talking about a very high technology, and this doesn't utilize any of that in its mechanism of action. COVID-19 vaccines will deliver a microchip into the body. Microchips. So yes, there are going to be microchips in the future. COVID vaccine is definitely not one of them. And again, you have to believe in a grand conspiracy, and who's going to run that? You're talking about billions of people. It's just internet fodder. It's stuff for people to read and to think in conspiracies and just not. It's not true. I don't need to wear a mask after I'm vaccinated. Again, vaccination helps to protect a person from severe disease and hospitalization. There are people who are exposed to COVID-19 who show absolutely no symptoms, make virus and spread it. So being vaccinated might increase your chances of asymptomatically carrying the virus. And that's why, especially when there's little epidemics going around and people are getting sick, you should always wash your hands, wear your mask, try not to touch your face, and keep your area clean, and limit your exposure to necessary exposure. And definitely do not go to work, do not interact with people if you have respiratory symptoms and you haven't had testing. And this goes back to the home tests or being tested, swabbed in the local clinic or whatever for PCR DNA to find out if you're infected or not. If you don't know and you're sick, you shouldn't expose yourself to people, and you should wear your mask. I only need 1 dose of the vaccine to be protected against COVID-19. Now we're talking about boosters. It was clear from the start that the immune response to one vaccine was half of what it was deemed it should be when vaccines first started. There were studies that said there was anywhere from 30% to 50% immune response. There was some protective element. Getting one was better than none, but we really didn't start seeing the communities getting better and the pandemic getting under control until you got both recommended vaccines. CDC recommends it. The science supports it. I should wait for the vaccine that is more effective. That's the last myth. The vaccine is extremely effective. There is going to be no better vaccine. It does its job. The human immune system responds, even though it's a transient response, and it looks like we're going to be using this technology annually in the future. That's what the recommendations are.
I just have to comment about vaccines. We do sometimes have different vaccines for the same disease. We have a change in the HPV vaccine from many, many years ago to now. We have a change in actually the pertussis vaccine from a long time ago to now. But that doesn't mean that in 2023, at this point, we shouldn't get this vaccine, because in 2030, we may have one that is a trivalent, for instance, and, whatever. This is the information we have now. This is the best we can do. And this is what we have. So we need to take advantage of what we have. And science will keep developing and we'll keep learning, but we have some good stuff now.
Absolutely. And yeah, of course, technologically in the future, we may get better and better, more efficacious medications. But this is a really effective tool in the toolbox right now. And waiting is counterintuitive to protecting yourself and using that tool to reduce your chance of getting sick from COVID-19. So the new booster is bivalent, which means it actually is subtly different. There are two different messenger RNA strands to make two subtle different proteins so that it covers both the BA4 and BA5 Omicron variant lineages. And now we're in a BA.5 something, as I said. These are the variants that stuck around and became part once people were no longer in pandemic and the numbers had decreased. These are the two subvariants that kind of evolved and stabilized in the community. And this new COVID bivalent vaccine, which we all got, and I believe I got, it was my 4th and 5th shot, have both BA4 and BA5 lineages, the recent ones. And it's what's predicted to kind of stick around, because when there's not a lot of people infected, you don't get a lot of mutation because less people are infected. And these variants tend to stabilize, and they will still change over time, but they will take longer to change over time with less people being infected. Okay, so this kind of goes over the number of people who have not received the vaccination in our data. And there were 122,066 Gloucester County residents who have not received at least one dose of COVID-19. And that's this. Actually, let me go back. There were 130,140, I think there's a zero missing, Camden County residents and 122,000 Gloucester County residents who did not receive at least one dose of COVID-19. And that's why we're here today, is to encourage our community to please get vaccinated. Help to protect yourself, your family. The city of Camden has 26,717 unvaccinated residents, which represents 1/3 of the population of the city. And that makes me sad. Again, we should be doing a lot better than that. Since the start of the pandemic, there's been 1,834 COVID deaths in Camden County and 1,005 deaths in Gloucester County. And the hope is that these aren't huge numbers, but these are people, and this is a significant number of people, is that if we can get more people vaccinated, we're going to see less deaths associated with COVID-19 vaccine with COVID infection. Having said that, I understand that 2023 conditions are different than the conditions that were happening in 2020 and 2021 when we had those earlier variants. So we have less deaths, but we don't want any deaths. And if you can get vaccinated and help protect someone from getting sick or dying, that's important. Every person matters. The low vaccination rates must be increased as vaccinations have been found to reduce serious illness and death, as we have said. Okay, this is Dr.
Okay.
Burton's slide.
Okay, so this is really just about our children, and I didn't know the exact numbers until I saw this slide that over 180,000 children have been hospitalized for COVID. It feels like it was more, but I'm sure it's at least that number, and more than 2,000 children have died. And you know, the numbers are different when you look at the adult numbers, but I always feel this way when it's your child that's sick or hospitalized or dies from a preventable disease. This is 100%. So there's nothing more important. And when we have this tool, like Neil keeps saying, we can prevent this. Definitely children have risk factors just like adults do, and they're very similar. We've all heard about asthma and diabetes, obesity, sickle cells, cystic fibrosis. I mean, there's the children with cancer. So there's a lot of risk factors for these children as well. And I remember early on in the pandemic, I think the first child hospitalized at Cooper was an adolescent who was a really large child or teenager with hypertension, and he almost died. And this was before vaccines. And I mean, it was really terrible. The vaccines for children are incredibly safe. On here, it says COVID-19 vaccines are the most closely monitored vaccines in US history. I always say that vaccine studies, that is the most closely monitored thing that we do for children. And they are not just putting out a vaccine without incredible research and development and information. And before anything's even put out, the trials have large numbers of adults and then kids in them, and nobody does anything to a child without incredible information. So I personally haven't seen any significant reaction in children in this entire time. And as everyone knows, a lot of the adults, we had some significant reactions. We were tired, we had fever, we had pain, we got redness at the site, we missed work for a day or two. Some people had more problems, but the children, just like children always do, they always do better than the adults. So, yeah, and now we vaccinate as low as 6 months. So the infant can get their first vaccine at 6 months. It can be given in conjunction with the 6-month-old vaccines as well. And like the adults and older kids, they get a second one a month later, and then they'll get a booster. So it's very similar. The dosages are smaller, but that's really the only difference. And yeah, that's what I can say about the children and vaccines. Neil, this is an action plan here. It's just saying what we want to do at Camcare, that we want to host vaccine events. We did this early on, and we want to do it again because we know that we need to vaccinate 33% of the community that we're working in. And we have gone into churches, we have gone into housing developments, we've had educational events, but we've actually brought vaccines to different areas of the city. And again, we've had vaccine clinics in our offices. O'Neill, here is the 25 Wawa gift card.
Yeah.
That is
Or
given.
gift card maximum
And-
per person.
Yeah, that's, yep. And again, it's just anything we can do to get people in, whether it's education for some or a gift for someone else, or bringing the vaccine to them versus them having to come to us. That's really what we want to do. But we need to vaccinate, like we learned, 33% of the community.
Yeah. I just put up our hours for
Okay.
a community that's watching. So Gateway has Monday and Wednesday from 4 to 8 o'clock. We have our vaccine clinic, and Clementon is 4 to 8 on Tuesdays. So we're vaccinating on Mondays, Tuesdays, and Wednesdays. Gateway, the 817 Federal Building in right across from the police station, in central Camden, from 4 to 8, and then our Clementon off the White Horse Pike in Clementon in New Jersey from 4 to 8 p.m.
And these hours coincide with the hours that were open normally at these offices. So these offices are open, they have full staff and
Little bit of music,
departments.
just a little bit for the community, a little program that runs hopefully smoothly.
Oh,
And we're almost done. If it, there we go. It's struggling to play.
yeah.
Come on. It's got to be my internet. Anyway, I'm gonna anyway, it just goes over the hours. So we gotta focus. Oh, it doesn't want to stop.
Sorry. Oh my God.
Playing. Oh,
I'm so sorry.
Oh,
That
that's
was,
that was you. That's good.
yeah, it came
It's
on
working
time.
It's not. All right, let's stop. All right. Let's open this up to any questions. I will stop sharing.
Okay.
All righty. Any questions for anybody? Chime in. I guess we can monitor the chat. There's some stuff in the chat.
Yes, Tasha was kind enough to put some statistics in. The
great.
XBB.1.5 variant is accounting for approximately 73% of current transmissions,
Wow.
and the common symptom is mistaken for allergies. Followed up with vaccines are our best tool in prevention.
Yeah, it's interesting. This new variant, there's a lot of sore throats and runny noses, and it's during the allergy symptom. And I actually had that, and I was convinced I had this new variant, and I checked myself twice, and it was negative. But you can't tell the difference between the allergies and pollen and this. It's Tasha, that's so true.
Yeah, that is really an important thing. I tell people, I really can't tell a cold from COVID. There's not a pathognomonic thing that happens when you get COVID. And so it's just something to keep in the back of our heads. There's not a problem with testing. You can't test too frequently. And so it's just something to think about for all of us to talk about and do if we or our family gets ill. So Bob said, I had a question. When is the 5th shot available and when should it be taken? The bivalent is available now. And you know, I've not been one to time my vaccines. You know, some people have talked about, well, should we wait until the fall when we gather inside and when we have more respiratory illnesses? I think that all of us should be fully vaccinated. And if you haven't had a vaccine since before September 2022, my advice is you need to get one. If you had one, like I already did, October of 2022, I can get that next one anytime. I unfortunately got COVID recently, and so I am going to wait, but that's my only reason for waiting, is because I don't need to get it right this second. But certainly risk factors matter, certainly age matters. You know, sometimes I've heard the saying, if you're 60, you can walk. If you're 90, you should run and to get your vaccine. So those are things that you can talk to your doctor about or privately ask other questions.
Yeah,
I
I
agree.
think
Sorry, Dr. Kaplitz. I just wanted to agree with you. The CDC does recommend that if you did have a recent COVID infection, you should wait 90 days and then get your booster. I also wanted to go back and just mention what Dr. Kaplitz said about the allergies. This new COVID strain is not giving the original symptoms. Remember when we lost our taste and smell? That was like the cardinal sign that you had COVID. But this new strain doesn't really give you that. You still keep your taste and you still keep your smell. You don't even get a fever. You kind of just be more tired, more congested, more like, is it allergies? Is it COVID? Is it a cold? So you, like Dr. Burton said, you really can't test too much, but vaccines definitely help. I was also someone who got vaccinated in October of 2022, and I recently contracted COVID in March. So I would be glad to get it as soon as I'm eligible.
And I will say that I don't consider the failure of the vaccines that I got COVID. I consider that I could have gotten sicker if I had not gotten the vaccine.
I was just going to say that too, Dr. Burton, that I had gotten my vaccine shot. I think it was September of last year, and I got COVID in February. But it was really just a bad cough, and mucus. But I was happy that I had the vaccine, to make it less.
Exactly. And also remember that there are, for some people that are older, if there's anyone older in the audience, that it's something to talk to your physician about if you get COVID, because you might be a person that is more at risk and perhaps you should be taking a medication. And so it's good to keep your physician in the loop of your illness. Even if you just do your test at home, it's no problem to, for instance, for the parents to call us, the pediatricians, and have a visit either by telemedicine or phone call, whatever, and to discuss, what we and you should do.
we definitely recommend, if you haven't received your bivalent booster, to get your bivalent booster.
Yeah.
Even and that's a necessity. And then I think after those shots, we're probably going to get CDC recommendations for the yearly vaccination with flu, and that will happen right before flu season. So we'll probably all get our next shot around flu season.
Okay. I'll be doing that.
It's a guess. We have to wait to see what CDC comes out with.
Yeah.
Now I know we're coming up on time, but I do want to give a special shout out to Daniel from Language Line with us. The plan was to have a second interpreter with us. However, Language Line did not accommodate that in a timely fashion. So I do want to give Daniel special kudos for hanging in for the full hour, nonstop, translating everything in real time. So Daniel,
That's
thank you so
amazing.
much.
Thank you.
Daniel's arms hurt him a lot. He's got a lot of lactic acid in there.
Are there any other questions?
Just have a message from Connor here that I can read out real quick for everyone. Thank you for joining us and protecting our community. We would love to hear your feedback. We ask that you take a brief survey outlining your Camcare experience. If you would like to provide a testimony of your experiences, please reach out to Connor Johnson with your story. Send your testimony to cjohnson@camcare.net.
Okay.
And I imagine that we'll be playing this back so that our community can see this. I think more people actually see these recorded than they do when we go live, and I hope it's informative. And Dr. Burton and I really do enjoy doing this, and we would love feedback. I was probably a little uncomfortable the first time, and now I'm realizing I think I'm better maybe like see if I can get a TV gig, because this is kind of fun.
You are
So
good
anyway.
at it. All right. Thank you, everyone. Have a good
Have
night.
a good night.
Thank you.
Thank everyone.
See you soon.
Thank you, everyone. And
Bye-bye.
yes, this is recorded, so we will have a copy for everyone.
Thank you.
Great
Bye-bye.
job, guys. Thank you
Thank
so
you.
much.
Thank you. Bye-bye, everybody.
Bye-bye.
Bye.